They are to you and your health, but sometimes a controversial story can cause an almighty row.
And tonight is about a London radio station and an NHS doctor, and the debate between them has gone all the way to the House of Commons. Earlier this year, Dr. Ben Goldacre was listening to a phone-in on LBC on the subject of the MMR vaccine, and he was furious.
He felt the show was not only inaccurate and ill-informed, but it was actually dangerous. You see, since a possible link between MMR and autism was first reported 10 years ago, immunisation rates in London have plummeted and outbreaks of measles and mumps have been on the rise.
So, here is Dr. Goldacre with his personal view of how the media could be putting our children at risk.
My name's Ben Goldacre. I'm a doctor, and I get annoyed by people who spread misinformation about medicine.
In January, Jeni Barnett from LBC put out a show on MMR and autism which contained, in the course of just 1 hour, some of the most amazingly foolish claims I've ever heard.
There are some children, whether you like it or whether you don't, who have a response to that triple jabbing that is not good for them. We have evidence, however much people say we don't. Don't make people feel guilty if they make a decision that they don't want to have drugs put into them.
Every single medical expert that you've ever had on has always said that the NMR is a good thing and that all of the evidence against it has been refuted.
Does that make it right? If you are funding a vaccine as a drug company, you are going to want to frighten people into having to take it.
Now, debate's good, but this was conspiracy theory and ignorance. The pharmaceutical industry have certainly been guilty of cover-ups, but MMR just isn't one of them. And it's not as if scientists have ignored the question. Researchers in Denmark looked at 500,000 children. 400,000 had MMR, 100,000 didn't. And yet the rates of autism were the same in both groups. You've not heard about research like this because the media choose not to cover the evidence that goes against their scare story. I can't blame parents for being terrified. And as a result, MMR vaccination rates have plummeted, especially in London. We've had a mumps outbreak in 2005, and measles is rising at a pace that should make everybody think very carefully about what they're doing. Jeni Barnett's radio show was a classic example of the kind of irresponsible scaremongering that's driven the MMR autism panic for 10 years now. So I posted it, all of it, on my website. LBC didn't like that. They sent the lawyers round saying I'd infringed their copyright and I've no resources, I had no choice. I had to take it down.
But people all around the world decided to take action. Within a day, more than 5 websites were carrying a copy of the original broadcast, many more had transcripts, and within 2 days, more than 150 blogs had written about the story.
We asked LBC for an interview, but they declined, although they did give us a statement.
LBC 97.3 is London's biggest conversation, and we discuss topics which are controversial and vitally important to people every day. We reject any suggestion that we don't take public health issues responsibly.
The MP, Norman Lamb, put down an early-day motion in the House of Commons criticising Jeni Barnett and the media more widely for making ill-informed comments about MMR. I asked him why he did it.
I was horrified that this was yet another example of inaccurate reporting of something that's really important, because we're seeing a significant drop in take-up of MMR vaccines by families, and that's putting children at risk. And in some London boroughs, it's really dreadful, below 50%.
We're subjected to an endless barrage of scare stories in the media, partly through ignorance and mischief, but partly because journalists think that's the only way to make science and medicine interesting. The newspapers in particular seem to have a bizarre, ongoing project of dividing all the inanimate objects in the world into the ones that either cause or cure cancer. Evidence-based medicine, the science of how we know if something's good for us or bad for us, is fascinating. It's easy to understand, and I think the public deserve the chance to hear about these ideas. The media could be telling us about the real crimes of the drug industry. They could be telling us about genuine risks and benefits of everyday activities. But instead, they give us childish scares. And when you try to point that out, they call in the lawyers.
Ouch, in some respects. Just one back reference to that. The Danish research that he was talking about there, you can find in the New England Journal of Medicine. You can find that on the internet. And I stress it was the personal view there of Dr. Ben Goldacre, who has some pretty strong feelings about the media's take on medical stories, including some that we ourselves have reported on. And it is a message for all of us in our profession to be mindful of, which we are happy so to be. Right, you're watching London